Okay, so let's dive right into this. Today we're going to be tackling physician burnout, and you've given me some fascinating sources here. Research reports, personal stories, even doctor's notes.
Yeah, it's a real mixed bag.
Yeah, it really is.
Yeah.
And it's like we're really trying to get a feel for the whole game, right? From the dugout to the bleachers.
And what's really striking is that we're not just talking about, a few players feeling the pressure here. The
Right.
scope is huge.
Yeah, it's not just a few tired pictures after a long game.
Right, exactly.
Multiple sources are saying that over 50% of physicians in the U.S. are experiencing burnout.
It's a lot.
That's more than half the team on the injured list.
Yeah, and think about the impact of that one source even cited a cost of $4.6 billion annually because of turnover and reduced productivity.
Wow.
That's like losing a star player to free agency because you just didn't think about their well-being.
Right. Yeah, that's a major hit to the whole league, not just one team. But here's where it gets really interesting. Okay, so the sources suggest that this traditional triple aim of healthcare, better care, outcomes, and cost management might actually be part of the problem.
It's interesting, isn't it?
It is. It's like focusing on winning the pennant, but forgetting about the training regimen.
Exactly. And the sources are arguing that what we really need is to shift to a quadruple aim,
Okay.
where the well-being of the healthcare team, and specifically doctors, becomes a core pillar.
Right.
Like recognizing that you can't win without taking care of your players.
Makes you wonder if we've been so focused on the scoreboard that we've forgotten the players on the field.
Yeah. So what's at the heart of this? What's really leading to all this widespread burnout?
Well, a big part of it is this feeling of losing control,
Okay.
of becoming just another cog in the machine.
Right.
A lot of doctors describe feeling dictated by schedules drowning in paperwork. They're bound by these rules from insurance companies and hospitals.
One doctor even called it a fixing people production line.
Kind of loses the human touch, doesn't it?
It really does.
Yeah.
And on top of that, you've got this shift towards data over direct patient interaction.
Right?
Electronic health records were supposed to help,
Of course.
but they've actually become a huge burden.
They have. It's almost as if they're spending more time filling out scouting reports than actually playing the game.
Yeah, that's a great analogy. And actually, one source even suggested that EHRs are more focused on billing than care,
Oh, wow.
which just further dehumanizes the whole experience.
For both the doctors and the patients?
Exactly. And we even have a doctor sharing his own anecdote about how during a hospital visit, he felt like just another data point,
Wow.
even though he himself is a physician.
It's a stark reminder that even doctors aren't immune to feeling like cogs in the system.
Absolutely. And this all ties back into that immense pressure and the administrative burden that they face every single day.
It's a lot.
It really is packed schedules,
Yeah.
short patient visits, endless paperwork.
It's no wonder they're feeling overwhelmed.
No wonder at all.
It's like expecting a pitcher to throw a perfect game after a night of no sleep and a diet of junk food.
Right.
You just can't perform under those conditions.
And then you layer on top of all that financial pressures and, misaligned incentives, and it's like a recipe for burnout.
Yeah.
The system is often rewarding volume over value.
Right.
It's pushing these doctors to see more and more patients in less and less time.
It's like giving a bonus to the batter with the most swings,
Oh, yeah.
regardless of how many actually connect.
That's right.
Doesn't really encourage quality, does it?
No, it doesn't. And this whole emphasis on quantity really devalues the doctor-patient relationship.
Right. It's like they're on a treadmill.
They are, and we haven't even talked about how the politicization of healthcare adds yet another layer of stress.
Right. We've got this perfect storm, loss of control, data overload, time crunches, financial pressures, and now this.
Yeah, issues like, abortion and gender-affirming care, they create these ethical dilemmas
Of course.
and really interfere with the doctor's ability to provide the care that's needed.
Right? It's like the rules of the game are constantly changing.
Exactly.
Makes it impossible to play effectively.
It really does.
So we've talked a lot about the problem here, but what does this actually mean for us, outside of the dugout?
Right.
The fans, the folks in the stands?
Well, if you're a patient, this burnout crisis directly impacts the quality of care you receive.
Right.
A burned out doctor is more likely to make mistakes,
Sure.
to be less empathetic, and even leave the profession.
Right. So that means longer wait times to see a doctor,
Exactly.
difficulty finding specialists,
Yes.
and ultimately could mean poorer health outcomes.
Absolutely. It's a ripple effect that goes way beyond just the individual physician.
Wow. It's like a disengaged team on the field. The performance is going to suffer.
Exactly, but the sources do offer some glimmers of hope.
Okay, so it's not all doom and gloom.
Not at all. One key area is rethinking this EHR system.
Okay.
Imagine if we could design a system that actually helps doctors instead of hindering them. It'd be like having a state-of-the-art training facility.
So making it more user-friendly, focusing on patient care and less about those billing codes.
Exactly. Get the technology working for the team instead of against them.
Right. And alongside that, we've got to address those financial incentives.
Of course.
The ones that prioritize volume over value. We need to reward quality care, patient outcomes, and a holistic approach.
Absolutely. It's about focusing on the team's batting average and not just how many times they swing.
Right. Incentivize those home runs.
Exactly.
Not just striking out a lot. And, the sources also emphasize the importance of supporting physician well-being.
Yes.
Creating a culture that values work-life balance.
Yeah.
Offers mental health resources, and promotes autonomy.
It's about investing in the players.
Right.
Recognizing that their well-being is absolutely crucial to the success of the team.
And this isn't just about, hospitals and policymakers.
Right.
Patients have a role to play, too.
They absolutely do.
It's like cheering on your team, showing appreciation for their hard work and dedication.
Yeah, a simple thank you can go such a long way.
It can remind these doctors why they chose this challenging but ultimately so rewarding profession.
It's about remembering that human element.
The connection between the doctor and the patient that often gets lost.
Yes.
So it sounds like we're talking about a real systemic shift here.
We are.
Changing how we think about and value healthcare.
Absolutely. Moving from a system that's so focused on efficiency and profit to one that prioritizes well-being.
For both the patients and the provider.
Exactly. We need to go from burnout to support.
Recognizing that a healthy healthcare system requires healthy providers.
And that brings us right back to that quadruple aim.
Better care, better outcomes, lower costs, and provider well-being.
We need to hit a grand slam on all four.
This deep dive has really shined a light on all these challenges that doctors are facing.
Has.
But it's also highlighted that there's a potential for change here.
There really is. What's fascinating to me is that even amidst this crisis, there's this glimmer of hope.
So there's hope.
There's a growing awareness of the problem and a desire to find solutions.
It's like the fans are realizing that their cheers can make a difference.
Yes. They're not just passive observers. They can actually support the team.
So what we need is a collective effort.
From patients, policymakers, and healthcare institutions.
To create a system that values and supports physicians.
Because when you have a healthy and thriving healthcare system, it benefits everyone. It's about remembering that doctors are more than just players on a field.
Right.
They're human beings.
They have lives.
They've got families and passions and, even limitations.
And by supporting them, we're really investing in a healthier future for all of us. So for you listening out there, this deep dive really leaves you with a question to ponder.
It does. What role can you play in making healthcare more humane and sustainable?
It's a big question. And whether you're a patient policymaker or just someone who cares about the future of healthcare, your actions, your choices,
they all matter.
They can really make a difference.
Absolutely.
So as we kind of wrap up this deep dive, it's clear that physician burnout is a complex issue.
It is.
But it's not insurmountable.
Not at all. By acknowledging the problem, really digging into the root causes and working together. We can create a system that actually prioritizes well-being.
For everyone, right? Both patients and providers.
A system where doctors feel valued and supported and empowered to deliver the best possible care.
Absolutely. Well, thanks for joining us on this deep dive. We hope it's given you a fresh perspective on the challenges facing healthcare today and that you feel inspired to be a part of the solution.